Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, Homeopathic Consultant. My clinic address is 9701 Sarah and Court, Dublin, California, 94568. My phone number 408 687 1899 and email address homeomedicine@yahoo.com. Anytime when you are suffering from any disease at any age and you are not getting well, there is no improvement in your treatment, you can call me for the second opinion of your disease as well as of your prognosis. I can guide you according to the natural principle of the nature. When there was no medical science, even then the people were suffering from diseases and they were getting cured as well. How the nature was curing them. And after that, what type of hurdles has come up in our life from the environment, from the living habits, from the food, and all these things. So, by doing a survey from all these things, I can guide you about that one so that you can find out where you are stuck off, where your progress has stopped, why you are not getting well. So for that one, you can call me at 408 687 1899. Today's lecture is an English lecture because previous 3 days it was continuously in Hindi, and after that it was yesterday it was in Punjabi lecture. And we were discussing about the medicines, what the medicine is, how the medicines are prepared, what is the purpose of preparing medicines, and if or not, whether or not the medicines are curing our diseases or not. What is the role of medicine? So these are many more questions in front of us, and we can discuss all those points again in short period. No, there is a time for the next lectures. We are going to progressing towards the lower extremities of this body as we previously discussed about the abdomen. First portion we talk about the head, and after that of the neck, and after that the chest, and then the abdominal areas, and everything has been discussed systematically. What are the organs in different areas of the chest, abdomen, and what they do? The most important functions of those organs has been discussed previously in all the languages, Hindi, Punjabi, and Angrezi on different days. And yesterday we have completed this lower abdomen, or you can say as a whole abdomen has been completed. In different areas of the abdomen, what are the different organs situated, and what are the problems, main problems of those organs, and if there be any problem in any of the organs, how we can identify it. What are the important sign and symptoms of any organ being sick, and how it is indicated on our body and symptoms and normal go of life, how it affects it. So everything was discussed. And after that, we were discussing about the medicines. In English, I would like to explain this thing. And before I going to the lower extremities, I just want to explain this thing because this is the important thing. When one doctor like me says, uh, medicines do not cure diseases. When we say medicines do not cure diseases, it's a big question. It's a question mark. How we can say that? Then what for these medical colleges, these doctors and all that? What they are doing? They are doing prescribing medications, and we are taking medications. And by the name of medications, we are getting well. Then how we can say that the medicines are not curing diseases? So I explained it yesterday in Punjabi, and today I will explain this thing in Punjabi, in English. First of all, I will describe you what is medicine. The first thing is all the substance of the universe. They are having more or less effects on our body, just like the astrologers. They count the planets and are there and their effects on our body, and they ask you to wear some stones in your fingers, this and that. So that's their science. I do not comment on that one, but it is fact that all the substances in the universe are having their effect on the neighboring substances, neighboring planets, neighboring human beings, neighboring plants. Everything has the effects of the neighboring substances inside the universe. And what type of effects specifically we know, and what type of effects we are able to use under our command, those are known as medicines. Those are known as a medicine, and we use them as a medications. Simply, I can tell you, if you take an onion is a simple thing used in our kitchen and all that. Onion, ginger, salt, many things we use in our kitchens, and they are the normal substances. But why we use that one? Because we know their effects on our body. That if they are used in a normal our food contents, they will change our health in a specific way. Just like the ginger, it affects the indigestions, intestinal functions. Just like salt, it affects the collection of excess fluid inside the body. In the same way, all other substances, which are our neighbors. Neighbors means some of them are not under approach. Some of them are not under approach, but some of them are under approach. And those which are under approach, and we are using them regularly, even in our kitchen or day to day life, we know that they are having some of the effects on our body. They change our functions. Some medications, some substances, when you take them, they calm down your body. That just like passion flowers. If you take that one, they calm down, or even they lower the blood pressures as well. If something substances which is used and we know its effect on our body, those substances are used directly or indirectly to affect the present symptom of our body. Present symptoms may be physiological, present symptoms may be pathological. Physiologicals are the symptoms which a body, when it's run its normal course, normal physic body, normal go of life, those symptoms are known as physiology. Just like the respirations, we say 14 to 16 times per minute, that's a normal thing. Palpitation or pulse rate, we count it 72 to 80 times per minute, it's a physiology. Blood pressure, we count, and after that, everything even beyond our limit goes to the lab, and lab test it, and even then they say it's normal, because we have made a standard of health, and according to that we measure everybody, that if it fits in that sketch, is a normal. So every substance which can affect our normal physiological function in a health side, and how it affects that our physiological imbalance of the body or balance of the body, that is the quality of that substance. And those qualities of the substances are used for whenever it is required, that we want to lower the blood pressure or we want to increase the blood pressure, because we know the quality of the substances. We know passion flower can lower down the blood pressures. We know if salt is used, it can increase the blood pressures. Similar, there are creatic acid, digitalis, and many other medications we know now at this time. But the main thing is that we are using these substances because of their effects on our body, in whatever way they affect our physiological balance of the body. We take note of this one, and we consider this is the quality of this substance. And every substance has its individual quality. It's not matching with the others. Similarity and same, these are two words. Similarity means they are similar. Twins, brothers, or something, your brothers, sisters, they may be something similar with you by nature, by habits, by constitutions, by the color of your eyes, by color of your structures eyes, but they may not be same. Even the twins cannot be same. They may be different from the mentality sides. So this is what I want to say, that all these substances are having their individual character or individual properties given by the nature to every substance. And nature has made everything different. Every person is different. Every substance is different. And how you can say that they are different from each other? Generally, in physical world, we have physical reactions, just like sand and iron and salt. We were doing the experiments to differentiate the salt and sand and iron particles from each other. We were doing the practicals in our school classes, and we know that one. But some of the things which are not able to be differentiated by these simple experiments, and we know something like chemical reactions or chemical changes. We can heat them, we can cold them, we can feel their different reactions at different styles. Ultimately, we come to know that some of them are still similar, not same, similar. And ultimately, the human beings invented a new method of identifying these substances which are used as a medicines to individualize them, because nature has made everything individual. They are not matching with each other. Every substance, every human being, every tree, everything has something individual from the other similar type of substances. And then we invented a way of identifying the substances, how they affect our body. Every substance which is looking similar. There are many more things which can lower down the blood pressure. There are many more things which can increase the blood pressures, not only one. And when all those medications, so all those substances which are lowering down the blood pressures are put into another character, into another test, you can say, we have seen there are different qualities given by the nature to that substance, that not only it has quality to lower down the blood pressure, not as that it has the quality to increase the blood pressure, it has something else more than normal. And if we give those substances regularly to a healthy person, ultimately he will produce some of the sensations and feelings and symptoms and change the physiology of his body at a distance. And those are the characteristics, individual characteristics of that substance, or the quality of that substance, which is given to this substance by the nature, and this is an individual characteristics of that substance. Sand is not similar to salt, salt is not similar to iron. They are different things. But we were having quality experiments to differentiate them easily. After that, we have some qualities of chemical type of reactions and this and that. But after that, still there are something which remains to be identified. Some of the substances will look like similar even after chemical reactions. Then under those conditions, what we can do? This is what we can do. Therapeutic way of identification. This is known as therapeutic way of identifications. Then we reach to the actually individual characteristics of that substance. And on the basis of all these individual characteristics of any substance, we are using them as medicine. And maybe sometimes against that quality of their substances, maybe sometimes similar to support that quality of the substance to our physical body. So in this way, we know the qualities. And these are the special type of characteristics of every substances which we have find out after therapeutic investigations of a person. Again, I will repeat, therapeutic investigations of a substance is that how any substance given to a person, given to a female, given to the individuals of different ages, given to the individuals of different environments, effect. How they affect in summer, how they affects in winter, how they affects the males, how they affects the females, all that. And ultimately, from all the results, we will come across some of the characteristics. Some of the characteristics we will come across which will be similar in all the seasons, in all the individuals, male or females, children or old. Every person will show some particular type of symptoms, from some particular type of changes they produce inside the body of the children, in the body of females, in the body of males, in the body of other things. Those are known as the key notes of any substance. And these are known as active constituents. Active constituents of a substance are capable of affecting our human body in a different way. And all these substances which are used by the doctors, by other peoples in the kitchen and all that, they are having the qualities that they can affect our human body, our human life, our normal go of life in an individual character, not similar to the others. Every substance will produce something different. I can give you another example. Everybody knows about that the quinine is given for the malaria, and they are able to kill malaria. But there are azaradicta, there are memoradica, there are many more other medications, echinacea, which are used for malaria. Previously, we were knowing only one quinine, but now we know many of the things which can kill malarial parasite. And but when you use them on the human beings, their individual characteristics are different from quinine. physical function to kill malarial parasite is the same, no doubt. But they are having their individual quality, individual characteristics given by the God to them is individual. Azardicta, Nim, it has different quality how it kills the malarial parasite. First of all, it was given only for the malarias. Quinine, before the invention of quinine, Azardicta was given. And similarly, quinine, and I told you echinacea. Many other medications are used to kill malaria. This is only one example, but there are many more type of bacteria. There are many more type of diseases produced by the human body, and to kill those things or to combat that kind of situations, there are not only one, there are many more medicines. There are many more substances which can work accordingly. But all these substances are having something more beyond this limit. They are known as individual characteristics. And those individual characteristics are used as a medicine in homeopathic system of medicines to combat the overall system, to support the overall system of our human beings when we are using those substances to cure of the disease or also as a prophylaxis to prevent as a disease. Both things are done. That's a different story how they are doing ultimately. And a substance which we brought from the market is just a substance, just like I told about the onions, ginger, many other things. We bring it from the markets and they are simple substances and used in our kitchen or somewhere else as well. But ultimately, when they are brought, they are kept in the lab, then they are considered as medicinal substance. Means we can prepare medications from this substance. A man is a man. When he is admitted in the military, he is a military man. When he becomes police, he is a policeman. But the person is person. Substance is a substance, and that substance has its quality. And that quality, whosoever think that this quality fits here, they are selected for the military. The quality fits in the police, they are admitted in the police. And same way for all the professions, they are admitted. In this same way, every substance which is brought from the market and put into the lab, pharmacy, or whatever, they are known as certain step. They are known as medicinal substances. And when according to the different criteria of different medical system of treatments, Ayurvedic make it differently, homeopathic make it differently, allopathic make it differently. Just I explained many times, if you use poppy plant, opium, this is known as Ayurvedic. If you take out of this opium morphine and pethidine, that's known as the active constituents, but actually act inside the opium, but actually act inside the poppy plant, that is the active constituents, and that active constituents is morphine and pethidine. And if you use morphine and pethidine, it's allopathic. And after that, if you potentize this morphine or pethidine, plant is the same, the quality remains same, the the qualities to this substance given by the nature remains same, whether it's a poppy plant, whether it's opium, whether it's a morphine or pethidine, or whether it is prepared by homeopathic system of treatments. And the homeopathic system of treatments proves it. If we want to attack the physical body, If we want to change the physical extents in a short way, we need the material dose. We need the material effects of the any substances which is used as for the preparation of the medicines, because this is short living. All the physical effects are short living, and short living effect is just like a person is having a pain abdomen, and we need to remove it immediately, whatever may be the reason. That's a different thing. That's a different thing. We have not reached to the extent that immediately we need to relieve the pain. And under those conditions, we need the physical dose of the medication, physical condition of that substance which affects the physical body, which affects the physical functioning of our body, and that's given in the shape of opium, either in the shape of decoctions, even in the shape of morphine and pethidine injections or tablets, even, and this is given. They are affecting the physical body, the functioning of the body. Though homeopathic system of treatment also affects the functioning of the body, but in a different way. Your medication is forcibly molding your vitality or the physiological function, you can say, to work according to its nature. Stop peristaltic motions. Stop any pain or whatever it is, or the telephone line, disconnect the telephone line so that the information from the painful area should not go to the brain, it should not feel it. This is what they do. But this is a principle of the nature, guiding principle of this body. Whatever goes inside our body, maybe food, maybe poison, maybe anything which goes inside the body by mouth, by injection, by rubbing, in whatever way, our vitality try to expel it out. If it is changing our physiological level of the body by force, yes, the nature will work according to its nature, strongest nature of that substance. But ultimately, nature will not accept it, because this is not covering the actual reason. What's the reason of pain? You are giving opium and all that, whatever. What for? Nature wants to expel it out, even the food. You take food, whatever is required out of this one, that's a limited time. You need food every day. You need 8 hours food. And what does it mean? It means this body has taken up whatever is required within 8 hours, but actually, extra things, this body wants to expel it out, whatever it may be. And the same way, when you when you use any substance for physiological level to relieve immediate pain, even then, even then, it will be excreted from the body out, because this is not the natural constituents of our body. It's a different thing, and the nature wants to expel it out. Though for a limited period, it can suppress the physiological balance of our body. Until that, we will not feel any pain. But if the underlying process, the pain was caused by, has been relieved, ultimately after that you can feel well. But it was not the medications who has relieved you. No. Physiological functioning of the body is its individual functioning. We can support it, we can stop it for short period, but ultimately that short time stopping of the function of this body will again revised, again come up. And if the underlying causes of that pain was simple indigestion, and that indigestion has been completed within that period, you will feel relief. But side by side, Side by side, your vitality will expel the medicines out from the body by urine, by stool, by sweating, by breathing, everything. And suppose, and at that time, you can well imagine our vitality is suffering from disease, complaints inside, abnormality inside. And on the other contrary, you are giving him the medications, which is also contrary, because nature wants to expel it out, because it is not allowing the physiological function of the body to go normally, to digest it. But ultimately, nature fights on both sides to expel this medication out and to continue its normal function. Just simple example I have given you for the digestions or indigestions. If you have taken something which is causing the pain in abdomen, and we know that the digestion takes of the food substances, digestion takes a few hours to be digested, and ultimately, if the pain is bearable, you need not to take the medications. If the pain is unbearable, you take this kind of medications, and ultimately a period is relieved. But don't think it is a simple thing. Vitality has to fight on both things, to relieve the pain, to digest that things, also to combat this medication's effect, which was not the normal effects, which are not helping to digest the things. So in this way, it has to fight with the environment. That's why, suppose this pain is because of cancer, then ultimately the period of your painkiller, any painkiller, is limited. Till that, the vitality is suffering with from the disease, actually, the actual disease, plus the effects of this medications, and ultimately vitality wants to expel it out. And that medicine is expelled out from the body by urine, by stool, by sweating, by breathing, everything. And that's why after some time doctor says, okay, you have to take this tablet after 8 hours, you have to take this injections after 8 hours or 4 hours, whatever, because they have studied this thing, that this medication, our body or vitality is able to expel it out within this period. That is why they recommend to take the doses of the medications in that limited period. And in this way, in this way, we are using the medications. So I was at the stop that you bring some substances from the market, and we are using to prepare the medications. And how we say it is medicine. Ultimately, in all the sciences, whatever may be the medical science process of curing the diseases, every medication is tested on the human beings, on the lower animals, that if they are died, no problem. It's okay, no problem. We don't worry about it. But for the human beings, we are scared. And that is why this homeopathic system has come up in the field of this one, that we can prove most of the medications which are in a physical state dangerous, can kill the person, just like potassium cyanide, they can kill the persons. But we have a means, we have a way of proving even this kind of medications with a different way. That's known as potentizations. So I was saying that when a substance is brought from the market, it's a substance. When the substance is used in the laboratory for making the medications, this is known as a medicinal substance. And when this medicinal substance is given to the person, different persons, different sex, different ages, and ultimately it produces some type of characteristic symptoms away from the normal physiology. I just told you about the normal physiology, that there is a normal working, functioning of this body for all the organs, for all the systems. There is a specific type of function they perform, and their speed, their element, and everything. They do that. And ultimately, we note that any substance which was made in a medicine, according to the different Ayurvedic system or allopathic system or homeopathic, whatever, in a way, when it is given to an individual person's, how it has changed the normal functioning of the body. That is the quality of that substance. And on the basis of this quality, that it can affect the human body in this way. And it is not only physiologically, it's mental and physical. And physical from head to heel. Head to heel means it covers all the nine systems inside the body. So, whatever changes it has produced, and these produced changes are its quality, are its property given by the nature. And that is basically used as a medicine. Quality of any substance, a individual characteristic of any substance which are capable of changing the human physiology is are the characteristic of that substance on the basis of these qualities, that it can change the physiology, that it can revise the physiology, that it can diminish the physiology. Substance is used for those qualities, for those type of symptoms, and sometimes in the contrary phase, sometimes in the similarity of the phase. So most of the system, just like allopathic and ayurvedic, they are using the substances on the basis of contrary physiological function. Just like we are talking about simple indigestions. Indigestion, in case of indigestion, the nature is trying to expel out or increased peristaltic motions of the intestine, so that whatever we have taken in as a food should move forward and ultimately reach up to the end of the intestine to be evacuated like a stool. Or if it is mixed up into the blood should circulate throughout the body, and ultimate the portion of it regularly should go to the kidney, and kidney should filter that one and expel it out by the urine. Blood is circulating inside the body, ultimately reaching to the skin, and whatever the toxin and everything is, the skin expelled it out by the sweating. So, in this way, we use these substances, knowing their effect, that how they can change our physiology, means how they can affect our human body mentally and physically. On the basis, when we want to relieve those kind of symptoms, we use their material doses. Whereas we use the homeopathic type of potentization, so that the substance should not be harmful to the human beings. Because in all the other systems, medicines are tested, checked on the lower animals, and we do not care about if they die or not. And but in homeopathic system of medicines, we can prove the substances, medicinal substances, or the medicines prepared from any toxic substances, even on the human being, but in a different way. And that different way is known as potentization. I give many times this examples, and I have given it in the Punjabi and Hindi program as well. In the initial days, when there was a Hakim Ajbal Khan, Tanantar, Ved Tanantar, and different type of scholars of the medicines at that time, they were using sulfuric acid to relieve the liver problems, fatty liver, this and that, what now we are calling many names by that one. They were using this sulfuric acid. And you will be astonished because you know that the sulfuric acid, when it is given, put on the even a metal pipe with rust maple pipe, they bring out the whole rust is boiled drop of sulfuric acid. And I'm saying that the Hakims and Vaz, they were using the sulfuric acid for the liver. Even nowadays, we are using sulfuric acid, but in a different way. Just for example, they were using the same technique at that time. A drop of sulfuric acid is a drop of sulfuric acid, has all the qualities of that sulfuric acid, whatever it is given by the nature. And now you put that drop into a one glass of water and you ask the person to drink it. And it will not burn out your mouth. It will not change anything or burn it out anything in your intestines because it has dissolved. The local effects has been cut down. But the quality of the sulfuric acid, which was given by the nature, will remain the same. Whether it's a 1 kg, whether it's a 1 gram, whether it is a in the minimum quantity, the quality remain same. And second thing, if the smaller quantity is capable of doing what we need to do, why to give the drops of sulfuric acid? And when the human beings learned this kind of techniques, they started using not only the sulfuric acid, but many of the other substances which were injurious to life. And they are making the medications from those substances, and they know the effects of those medications, those substances, and they are now used in our medicine field, just like potassium cyanide. You know, nobody can judge the effects of the potassium cyanide because anybody could not check the taste even. When it touched the tongue, person is killed. That's strong poison. But according to this way, what I told you, that is known as the potentization, dilutions. In this diluting system of a homeopathic system of medicine, we are making the medications from these kind of substances which are directly injurious when they come close to our body. Phosphorus, we know that when it touches the open air, it burns out. But we have techniques now when when this phosphorus is dissolved into 1 into 99, 1 into 99, 1 into 99, which is the process of potentization of homeopathic system of medicines. And when it reaches to the sixth potency, no one can prove that there is a phosphorus. No one can see that it is burning with the air. When it touches to the air, it burns. Then how you can prove that? But this is the way. You can dissolve into even water, and ultimately you can reach with one drop of or one grain of any substance, maybe phosphorus, maybe anything, in 99 parts of the inert substance, which is inert substance means which is not having any medicinal property if it given to any person in its smallest quantity. Just like you can say alcohol. Alcohol is stimulating. When you take the alcohol, you feel narcotics, intoxicated. Then how you can say that? But if you take a one drop of tongue on the tongue, it is not going to affect you. It's not going to show you any narcotics or addiction type of things or narcotics type of thing. No, nothing. So in this way, phosphorus, when dissolved into 100 times of divisions, 99, 1 into 99, 1 into 99, taking one drop of substance, mixing it with 99 drops of inert substance, then taking one drop from this mixed substance and taking 99 drops of inert substance, again mixing it, and ultimately, secussioning means just mixing. Secussioning means just mixing that substance. And ultimately, when you reach to the sixth potency, no microscope of the world at this time, then even we are able to see the stars million light years away, but we can see that one. But we are unable to recognize any substance of phosphorus or any substance of potassium cyanide in that type of quality of dilutions. And then, and then, how it means it's not. You could say it's not, but it is. It is there. It has been proved by giving to the persons at that quality, at that combinations, at that dilutions, and they started proving. They started proving some of the abnormalities in their system, some of the abnormalities in their mental faculties. And nowadays, those are the keynotes, principal effects of those medications. And on the basis of those principal symptoms in children, in females, in males, in different environment, in different areas, whatever has come up conclusions, on the basis of that conclusion, that is known as key points, key notes. We are using those medications. And just like I told you about the potassium cyanide, it's the name in homeopathic is Kali cyanide, and this is used by homeopathic doctors specifically for the cancer of tongue. Most of the people are gum cancer and all that cancer, those who are chewing tobaccos continuously. And you see that there's a large number of people who are having gum cancer, who are having tongue cancer, and all those things. And this potassium cyanide has proved its efficacy when it is given to this kind of symptoms, but based on the symptoms, based on the characteristics, and all those things. Is the quality the same way the quality of the phosphorus, the same way the quality of toxic poisons, just like you know that if snake will bite, persons are killed. But the same poison, we have learned that if the same poison is drunk by some healthy person who is not having any sore inside the mouth or in the intestines, and he has digested it just like a food, no doubt, when it is assimilated from the intestines and gone to the blood, it has some type of symptoms, but they are not dangerous, they are not injurious. These are the key points of poison of that snake from which that poison was collected. Like cases, Naza, just a cobra, a snake, and all that. Different kind of snakes have their poisons, and those poisons are collected and they are converted into the medicines by this process, and they are being used widely by homeopathic doctors for the blood pressure, by the mental tensions, by all that you can liquefaction of the blood, and by many other symptoms, which are not cured by the simple other medications, and they are used for that one. They are used for that one, just like the worst example is about the sulfuric acid. Worst and more worse than that one is the potassium cyanide. And you will be astonished that we are using this potassium cyanide by the name of Kali cyanide in the form of potentizations for the cancer patients, and it has successfully cured the tendency of worsening of cancer. and it has improved all those things. So, in this way, we prepare the medications. Any substance brought from the market, put into the lab or pharmacy, is known as a medicinal substance. And when medicines are prepared from that substance in a different way, individual way, according to the different medical science, this is known as medicines. And now, most of the substances are used and are verified by their physical or physiological effect of that medications on the human body. Whereas the mental portion, because the everything which is given inside this body affects or change the mentality, feelings, desire, aversions, happiness, sadness, everything. The at the mental sphere has been changed, but we do not recognize that one. It's only the homeopathic system of treatment which recognize all these changes before there is a physical change. Mental change occurs. Just like you take a tea, cup of tea, your body is stimulated, no doubt. Everything is pain is relieved to some extent, tiredness is relieved. But before that one, you have a mental sphere functions. You feel activeness. This is what the mental symptom. So not only the tea, every substance which is given, even the food you take one, normal food you take one, it affects your mental state and you feel satisfaction. Oh no, I don't need more. Oh no, it's very good. How I feel, this is pleasant. Oh no, no, I don't like it, this one. This is what? After eating, they are having their effects on your mental level, and you are expressing this thing. This is also recorded, which is not recorded by any other medical science. Only the homeopathic system of treatments records all these things. And the same way, the potassium cyanide, the same way, the sulfuric acid, the same way, the poisons from the snakes and from the other animals are taken and prepared medications from that one. And we are widely having this kind of setup in homeopathic system of medicines, that we need not to go to the lower animal, we need not to kill the lower animals, we not need not to take the risk to prove it on the human bodies. We have a easy way, and we have an easy way to prove it on the human beings, and without any casualty, without any side effects, without any major changes inside these systems. We can prove them, and we can make them under the list of our home medicines, that yes, it is capable of doing this and this, and it is capable of curing this type of disease and this type of disease. All these things are, we are now capable of. That is why it's necessary. It is necessary that we should know the physiology, how this body is working, and we know the pathology. If a disease progresses from beginning to end, resolution of the disease, may person die or may person recover, end of the disease, what has happened? What was the path, way of progressing the disease or curing the disease ultimately? That is known as pathology. And if we are known to this kind of things, physiology, how this normal body is working, pathology, how the disease is progressing, and if you give any medications to any person, any type of disease, any sick persons, and after giving your medications, we note two things. One is accessory symptoms of the drug. Second, we note accessory symptoms of the disease. Disease is progressing, and you know that after giving the medicines, some other symptoms has come up which were not recorded previously in the history. And if you know that this disease, according to pathology, has a next step of advancement, and it produces this kind of symptoms, and these symptoms are now showing up, it means your medicine has done nothing and your disease is progressing. But suppose if you see, the disease is slowing down, and the medicine you have given to the person, the history shows that now at this time the person is having some type of extra symptoms which is not related, they are not related to the pathology of the disease, that if the disease progresses these symptoms will come up later on. No, it's not related to the aggravated condition or increased disease conditions in the person. But if you see that those symptoms are in the history of the medicines, but they were not in the initial stage of the sick person, but now they have come up. It shows the accessory symptoms of the drug. Whatever medicine you have given, sometimes when you prove the medication, most of the symptoms are not coming up at that time. But when you give that medications to a sick person, some of the symptoms show up at that time. They are stimulated because of the disease factor inside the body. Because we are testing the medications on the healthy human beings. And now it is a sick person. And on the sick person that the same medicine is given, it produces something other symptoms which were not in the proving of that medications, but side by side, the disease of the person is improving, is decreasing. But there are some accessory symptoms which were not in the history. And also, they were not in the history of the proving of the medications. Those symptoms are known as accessory symptoms of the drug, which were not produced during the provings, because the provings were done on the healthy human beings. But now we are verifying it to give it to the sick persons. Though I'm saying, though the disease is decreasing, person is improving, but with the improvement of the person there are some other symptoms which were not in the sick person, which are not the symptoms of the disease progress, means pathology, which were not in the proving of the drug substances, means an individual character, which were not shown in the disease, which were not shown in the healthy persons at the time of proving, and which was not shown in the sick persons. Those symptoms are known as accessory symptoms of the drug. Whether or not we should worry about that one. If they are increasing the pain of the person, we should worry about that one. If they are not increasing any pain of the person, and his previous symptoms are subsiding, no any aggravated in his condition, these are in good sense. And ultimately, according to the homeopathic principles, when you take off the medications, definitely those accessory symptoms will also improve and the person will get well. So this is what was today's lecture. I was supposed to go to the joint description, because we have completed the abdomen and we are now going to the lower extremity. Especially, I have to discuss about the joints, nature of the joints, what type of joints inside our bodies are working, and a characteristics of the joints I will discuss tomorrow in this lecture. I'm sorry for that one, that I mentioned that I will discuss the joints, but I could not, because this was an important lecture I delivered to the Hindi persons, I delivered to the Punjabi persons, but I could not deliver it into the English portions. So I delivered it. If ever you have any questions, you can call me 408 687 1899. And also, if you have any questions, you can call me 408 687 1899. When you are tired of any treatment or you are not getting well with even the best treatments or changing the treatment time to time, you can call me for the second opinion of your disease so that I can tell you what are the hurdles in your progress of the disease, why you are not improving. So I can just guide you according to the nature's principle. What are the nature's principles to cure this body when there was no medical science? Nature was curing the disease. So how it was happening. So we can guide according to that one. If ever you have any questions health related, you can call me at 408 687 1899. Or if you want to get homeopathic specific type of treatment for any disease, even then you can call me 408 687 1899. God bless you all. We'll see you tomorrow and we'll discuss the next chapter of our health education lecture series. Thank you.